So this is a subject that's kind of near and dear to my heart because I've had sort of a lifetime of dealing with addiction kind of stuff. That is to say that it's had a strong presence in my personal family, but it also was my very first residency was Arizona Pathways, which was a drug and alcohol rehabilitation center here in Arizona. And one of the things about working with people who have a chemical dependency is that really it's a constant reminder that medicine is a service. That is to say that we're not trying to fix because people aren't broken. We're not trying to help because we're seeing things as weak, and we're not trying to be anything other than just somebody who can be present. So the first part of this process is how do we even conduct the conversation? Because that can be challenging. Motivational interviewing is a particular kind of interview process that was developed in the 1980s at the University of Arizona, actually in Tucson, just a few miles down the road from us. It has been well studied because it is a pretty structured way of approaching that conversation. And it allows not just a set of generalizable skills and practices for the practitioner, but also the patients develop these things. And sometimes that's important for the conversations that they have in their own mind. So the motivational interviewing process assumes, first of all, that the patient's the expert. I often tell people, you're the PhD in your process. You understand what the relevant causative factors are, what your triggers are. You know what the deal is with your particular addictive process. And so it's important because in a lot of cases, and we'll talk some about this through this conversation, a lot of times there's a lot of shame, there's a lot of just feeling bad about yourself because you are making the wrong decisions, and maybe you've made a shambles of your life, maybe you've made a shambles of your relationships. People, when they get to the place where they feel like they need to start doing some kind of an opiate withdrawal process, they are usually at some place that is more uncomfortable than the drug can reverse for them. And it's important because we are altering our states of consciousness. And we also know that the sense of self and that subtlety of consciousness, it is in the peripheral domain of our nervous system. It is in those areas where the nervous system is most recently creating new connections. And when we put a substance in that process consistently, day in and day out over a long period of time, that nervous system is going to adapt and conform itself to the presence of that substance. That's the physical result of using any substance over a long period of time. So what we do is multifaceted. We do a lot of different things. We will generally, once we get them through the initial acute withdrawal phase, depending on the person, that could be 10 to 30 days. We don't put a naltrexone implant into them generally until it's been at least 2 weeks since their last dose of whatever narcotic they were taking. Botanical agents, Leonoris and Leonotis, both are wildly wonderful for anxiety elements. That point of connection. Leonoris very much is like a hug from your mom kind of a thing. So cosmic kind of a pacification. Kratom, basically we are putting something in that is also a partial opiate agonist, like buprenorphine or tramadol. Inositol is an intercellular messenger. Phosphatidylinositol is another phospholipid group form of this particular compound that becomes part of the cell membranes. It helps establish healthier cell membranes. And so it helps with people that also have chronic long-term depression that's just unresponsive to other agents. Piracetam, Oxiracetam, Aniracetam, Levetiracetam. We could literally talk for hours on these guys because there's such a rich family. There's over 35 members of this family. Capra is the member that has become the darling of seizure treatment in the United States currently. Agents that are really profound for helping us evoke us to altered state of consciousness, and then also to process through some of the trauma that we are experiencing. Here again, another quote from Terence McKenna, because, Terence should be remembered.